Hello, I'm Dr. Laura Fenimore, and I'm really delighted this morning to have the opportunity to speak with Claire Steiner. Claire is a recent graduate of our family nurse practitioner, and she'll describe a little bit for you about what her current role is all about. Claire, thank you for joining us.
Thank you so much for having me. It's a pleasure to talk about my role as an NP, especially because I just graduated in August.
Wonderful. Tell us about it.
Sorry, which one?
Your role and
My
what you're
role,
doing.
great. I work as a nurse practitioner, and I'm also the obstetrics, gynecology, and transgender care coordinator at Allegheny Reproductive Health Center. I do everything from like calling in prescriptions, talking to patients on the phone, doing telehealth visits, as well as like minor procedures like colposcopies and DNCs. Because I just graduated in August and I also just passed my boards last Wednesday. I'm still
Congratulations.
Thank you. Thank you. I'm still practicing under the supervision of my boss, Dr. Sheila Ramgopal. It's a private practice. Dr. Ramgopal is the sole owner. We're not affiliated with either UPMC or with Allegheny Network, but we do take all insurances. So it's really nice kind of being able to like see everybody from across the board. So I do a lot of things. I'm definitely still learning. At our clinic, we do routine like prenatal and obstetric care. For those visits, I will see people in the office, talk about how their pregnancy is going, kind of help manage any conditions that we're dealing with, such as gestational diabetes or hypertension. I don't deliver any babies, though. Dr. Ramgopal takes care of all of that and also participates in the prenatal visits. For transgender care, Dr. Ramgopal does hysterectomies and other kind of gender-affirming surgeries. So Dr. Ramgopal does all of those, those surgical consults. But I'll see people afterwards to like follow up, see how things are going, check incisions, check bleeding. We also do just routine gynecologic care, so insertion of IUDs, annual visits with pap smears. I do all of that. I'm still learning how to do colposcopies, which are a follow-up after an abnormal pap smear. We also do hysteroscopies where we're looking inside of the uterus with a camera. We do this in our office. I'm still assisting with those, but at some point, we're hoping to move me into doing those independently. Additionally, we also do provide abortion care at our clinic. We in Pennsylvania, nurse practitioners are not allowed to stop a fetal heartbeat, so I will do like a DNC, which is a dilation and curettage for miscarriage management, but I don't provide any abortion services as a nurse practitioner. We also prescribe hormones for people who are either postmenopausal or transgender. Really anything you can think of that is like for a person who has like a uterus or ovaries or vagina, and the endocrine system we pretty much do as much as we can.
Wow, it sounds like you have a very diverse role with lots of different patient populations and needs that are present for women. Tell me a little bit about why women's health. What was appealing to you of all the choices that you could have made after with a family nurse practitioner degree?
I think reproductive health always really spoke to me. I was looking for kind of a women's health program, but Pitt offered the DNP as a family nurse practitioner, and that was more appealing to do the DNP program rather than to be and learn more knowledge generally than to like just kind of focus specifically in women's healthcare. But yeah, I feel like it's always just interested me, and like it's people who like reproductive healthcare. People are really vulnerable. And as nurses, we want to take care of people, and this like it's always been it's ripe with opportunities for getting to take care of people.
So to tell us about maybe a woman that or a young woman that you worked with, where you really felt like you applied what you learned in Pitt's DNP program as a family nurse practitioner? Maybe one that
Yeah.
comes to your mind.
Yeah. So we've had people who come in with a lot of comorbidities. And my boss, Dr. Ramgopal, is trained as an obstetric and OBGYN, isn't quite as well versed in managing blood pressure or thyroid medication. And so it's really, I think like I've been a good partner in that to like, people who are pregnant, like making sure, like, how are we monitoring their thyroid? We have a pregnant patient right now who we've been keeping an eye on her TSH and her thyroid hormone. And I've been the one adjusting her Synthroid doses.
Mm-hmm.
And because, Dr. Ramgopal, it's like, it's nice to have more general knowledge and work with a specialist.
Mm-hmm.
There was another woman who came in whose blood pressure was through the roof. She was on like a very low dose of metoprolol. And so, I was like, oh, I know how to manage this. So we're going to look at the JNC8 guidelines. And so we came up with like a good plan together of how to manage her blood pressure.
You mentioned that you offer telehealth visits as well. So what's that like? In this pandemic, it seems like a lot of folks are receiving their care through telehealth visits. What's that like as a provider on the other end of the camera?
Yeah, I mean, in some ways it's a little bit frustrating because you can't do a good physical exam and see people like right in person. But on the other hand, like it really allows people, we're really expanding access to care. People who are, people maybe who are transgender, who are living in rural Pennsylvania, don't have to drive hours and hours to our clinic. We can meet with them over video conference, have them, get blood work done at a Quest Labs or something else remotely, have those results sent to us. So then we can prescribe them like testosterone or other hormones from far away without them having to travel.
Mm-hmm. And working with the transgender population is not something that I think most nurses are necessarily prepared to do. How did the DNP program that you just finished help you with that? And what else did you have to learn that you didn't know?
Yeah, so I think Pitt did a really good job preparing me to work with the transgender population. The like classes with Brenda Cassidy and also with Dr. Founds, there's a lot of, they make an effort to, have a lecture in there about what we're doing with like, special needs for the LGBTQ population. I also had the opportunity to have a rotation at Central Outreach Clinic, which focuses on care for LGBTQ people. It's located in the north side in Pittsburgh. That was a really great experience for helping to train me.
Mm-hmm. And what other kinds of clinical experiences did you have as a student in the FNP program?
Yeah, so I had a bunch of primary care rotations with different primary care docs around the city. I also had 2 different pediatric rotations. One was in the South Hills. One was with one of my dad's friends who they went to medical school together. So that was really fun. I don't think I had seen him since I was a little kid. That was all the way out in Beaver, though. Mm-hmm. And then I also rotated at Allegheny Reproductive Health, and that helped me to get the job there. I met Dr. Ramgopal. We figured out that we had, very similar goals in providing care. We both wanted to participate in harm reduction models and like patient-centered care. And also we realized that we worked really well together. So Dr. Ramgopal hired me pretty much straight out of school.
That's cool. I think many advanced practice nurses may have a clinical rotation as a part of their doctoral studies, and then they end up in a position. That very same thing happened to me too. Mm-hmm. So I appreciate that kind of experience. Tell us a little bit about the scholarly project that you worked on as a part of your DNP.
Yeah, so I knew I was interested in reproductive health coming into the program, and then looking for a project for my DNP program, for my DNP project. What I did was I decided to focus on the HPV vaccine, Gardasil 9, which is a vaccine that protects against 9 strains of human papillomavirus. And that's the virus that causes most cases of cervical cancer, penile cancer, vulvar cancer, and also mouth and throat, so oropharyngeal cancers. I worked with the health department downtown. I did big literature review. Dr. Cassidy was my advisor because she has a ton of knowledge about this. We found some programs that have been developed to address some gaps in the literature, which was provider, so like nurse practitioner, physician assistant, dentist, physician, etc. Anyone who's recommending the Gardasil vaccine. We really wanted to address beliefs and recommendation skills, because everybody, knows that like we should be giving this, but instead of recommending so the recommendation is that kids between 11 and 14 receive 2 doses of the Gardasil vaccine, HPV-9. Along with those, kids get like a Tdap and a MMR, not MMR, sorry, the Menacui, then ACW and Y, the meningitis vaccine. So a lot of people are saying like, oh, your child is, going into 6th grade, they're due for these 2 vaccines, this Men, ACW and Y, and Tdap. Oh, and then there's this other vaccine. Do you want that? Expecting that parents don't want an extra vaccine for their kids. And so we did a training program talking to people at the health department. So the nurses at the immunization clinic, people at the dental clinic, as well as people at the STI clinic, saying like, here's how to give a really good recommendation. And then afterwards, I did a retrospective chart review only at the immunization clinic, and it looked like they had doubled their rates, which wasn't hard to do. It went from about like 17% to 35%.
But progress.
Yeah, still a lot of progress. Yeah. And a lot of people who I talked to said like, oh, you know what? I didn't realize that this was recommended as strongly as the other 2, adolescent vaccines that we're giving.
So if you were educating a parent about HPV, what would that look like? Or how would that sound?
Yeah. So I would say, your child is 11, 12, 13, 14 today. It's time for their adolescent vaccinations. So the first one is tetanus, diphtheria, and pertussis. It's a tetanus booster, and more importantly, it has a booster against whooping cough. So any like small babies who they're around will be protected. The second vaccine is Gardasil. That's the vaccine that protects against cervical, vulvar, and oropharyngeal cancers. And then the third vaccine is that meningitis vaccine, and they'll get a second dose of that in a little bit. And so what we're recommending is that people sort of sandwich Gardasil in between the other 2 vaccines to really get that strong recommendation.
Wonderful. Well, you've given us a great little lesson right here in this interview about being a family nurse practitioner, about how to talk with families about vaccination, which is an important topic, and I suspect will be even more important as we start to think about a vaccine for the COVID-19.
Definitely. Yeah, I think another thing that providers really gave me positive feedback on was how to answer parental questions, right? A lot of providers interpret questions as pushback and then say like, okay, then you don't want the vaccine. But parents just have questions, right? And so asking like, what are your questions? What are your concerns? And then answering those specific questions is really important.
Excellent. Very good. So you've passed your boards. You are in this role that you loved, and it sounds like you're really good at. So
Thank you.
Congratulations to you on all of that. If you were to offer some advice to a first-year student who's thinking about becoming a nurse practitioner and really doesn't know which of the populations they want to work with or what they should do, what advice would you offer them?
Yeah, so I'd say you don't have to know what you want to do forever. You just have to decide what you want to do next. You're in nursing school, so you've already made a huge decision, and you're going to have a great career. You'll never be bored as a nurse. There's so many directions you can go. Sometimes that sort of like that plentitude of directions can be overwhelming. So something that helped me was to shadow people. People who I worked with in the hospital or knew through my parents or just cold called. If I thought I might be interested in their role, I would, call them, email them, and ask like, "Hey, I'm a nursing student. I might be interested in doing, X, Y, or Z. Once I'm done, could I come in and shadow you?"
Mhm.
And that was really helpful in helping me to see like the day-to-day operations of what each kind of nursing job, healthcare job is like, and helping me figure out what I wanted.
Excellent. We've actually heard that recommendation from some other folks as we've been exploring these different kinds of roles of advanced practice nurses. So, Claire, thank you so much for your time today,
You're so
and
welcome.
best of luck to you in this new role.
Thank you. Thank you.
You're welcome.